I've helped over 500 people fix their chronic lower back pain. Here are 25 things that actually work that you won't hear from your typical physio. Number one, more pain doesn't equal more damage. You might have been to go get an MRI scan or some sort of scan on your back. If we take two different patients, one patient might have a really, really bad scan, but they might not report any lower back pain. The other person might have a great scan, and on the scan there's no damage, but they might actually report a lot of pain. So pain is far more complex than simply just more damage equals more pain. Point two, perfect postures don't exist. You might have seen a load of stuff on Instagram or YouTube talking about bad and good postures. There's simply no such thing. The research suggests that being in any particular posture for a long period of time is linked to increased risk of developing and maintaining lower back pain. So whether you're slouched or slumped or your shoulders are back and you're nice and upright, it doesn't really matter. If you work from a desk at home, just make sure you're changing your postures and positions frequently, so you're just keeping the back moving and keeping blood flow to the area. Point three, you're not fragile, and the discs in your lower back and the muscles around it and your whole body can repair itself if you have the right plan in place. So people telling you that you're broken and you're just getting old is the reason you've got a bad back. It's complete rubbish. Point four, don't fight tension with tension. So when you get lower back pain and you've got a really tense lower back, the last thing you want to do is try force it through more tension. What I mean by that is going and aggressively trying to stretch it or aggressively trying to lift weights. The key to fixing lower back pain is slow and smart progressions. It's not trying to force your way through anything like you can do in the gym. This is completely different, and your body will just shut off, and it can potentially make the lower back pain a lot worse. Point five, recovery isn't linear. Training is very different to rehab because we have this aspect of pain, which is very complex. So in training, if you're trying to get a bigger back squat, for example, you might have a linear progression week to week or month to month, and you just keep increasing the weight in the gym and you feel good. With lower back pain, 1 week, there might be something going on at work, worse sleep that week, your nutrition might be off, something else might be going on in your life, and you just need to be aware of this. Dips and troughs are normal, but overall we want to see a positive correlation and your pain decreasing over the long term. So look at it in terms of months instead of day to day. Point six, retraining your brain actually takes a long period of time. Half the battle with lower back pain is retraining your brain to understand that the movements that caused you pain in the first place aren't necessarily unsafe. You just weren't strong or mobile enough to handle these positions. Number seven, the knee cave myth. So you might not think your knees relate to your lower back pain, but this one is massive. You might have been told that you shouldn't let your knees cave in. You actually need to let your knees cave in and roll in because our foot is actually designed to pronate or roll inwards. It's a normal part of gait, which is walking, and a normal part of everyday life. And this will also allow you to internally rotate your hip or your femur, which is the bone between your knee and your hip. If you don't allow your hip to internally rotate, you'll lose this range of motion. And what can happen when you're squatting, instead of going through and using your hips to internally rotate, you'll find another way to put force through the ground. So instead of using your femurs to internally rotate and letting your knees come in when you come out the bottom of a squat, what you'll do is you'll dump your pelvis forward instead and arch through your lower back. So you put the stress there instead. Number eight, you need to fill up different buckets to progress with lower back rehab. So you need to improve your mobility, your strength, your confidence, your conditioning, and you need to take water out of the pain bucket. So your pain will decrease as a result of filling up the other buckets. It's not as simple as just focusing on one thing. You need to have a broad approach when you're trying to fix your lower back pain. Point nine, get your pelvis moving well. So if you don't know, your pelvis is your hips. We want to improve your ability to anteriorly and posteriorly pelvic tilt, which is very simply rolling your pelvis forward and rolling it back. You also want to improve your pelvis's ability to shift side to side or laterally, and then also to rotate like that. Getting your pelvis moving well will reduce tension in the lower back, get the muscles to relax, and it will also improve your hip mobility. Number 10, get your rib cage moving well. So this relates to breathing, and a lot of people are very much belly breathers, or essentially they don't expand their rib cage properly. Good breaths involve the rib cage expanding anteriorly and posteriorly. So essentially, as we're breathing in, the front and back are expanding at the same time, and then they're closing at the same time. We want to do lots and lots of breathing drills, focusing on smooth inhales through the nose and smooth exhales through the mouth to get the ribcage opening and closing. Again, this will reduce a lot of tension in the lower back and just improve how you're feeling day to day. Number 11, get your spine moving. So anyone that's told you that your spine should move is telling you a load of rubbish. The spine has got loads of different joints, it's got loads of different vertebrae, and it's designed to move. It's designed to flex, it's designed to extend, it's designed to side bend, and it's also designed to rotate and then do all these different things at the same time as well. So make sure you do this in your lower back rehab. Number 12, improve your hip hinge. If you've got lower back pain, and very commonly people get it from deadlifting or doing hinging movements in the gym like RDLs, a lot of the time because they can't use their glutes properly. So the lower back will take over. We want to retrain your ability to hinge properly, so the spine stays in a nice neutral position and all the load is going on the glutes, which is the larger muscle compared to your erectors in your lower back. Number 13, get your feet moving well. So this ties back into the knee cave myth. You want to make sure that your foot can pronate, so roll inwards, and then supinate. And so you want to understand the feeling of outward foot pressure and then inward foot pressure, which will then affect how your knee functions, how your hip functions, which will tie in and affect how your lower back functions. Number 14, do more med ball circuits. This again ties into getting the spine to move a lot, and this combines a lot of the movements all together, and it gets you and teaches you to absorb force in a more dynamic way, which obviously relates to everyday life, but also to sport, which can be quite unpredictable. You can be as creative as you want with these, just making sure you're not going for max power straight away due to pain in the lower back. You want to build up nice and slowly and steadily, so you can start off at about 25 to 50% of your max power and then build up to less reps at your max power. Number 15, do other sports outside of the gym. So if you just go to the gym 3 days a week and all you do is move up and down lifting a barbell, you want to go outside of the gym and explore other movement options. Football, rugby, tennis, squash. And again, this hasn't got to be like loads and loads. It might only be once a week and you just try loads of different sports, but this will just open your body up to lots of different movement options, which will improve your mobility, make you more athletic, and it will reduce your risk of getting lower back pain, because our bodies are not just designed to be moving up and down like a block. Number 16, don't neglect lower body strength. So during lower back rehab with clients, I don't just get them doing these breathe in and rib cage and spine and pelvis exercises. I also make sure they're continuing to build lower body strength in the gym. So how do we do this if someone's struggling with lower back pain? Depending on the level of the person, we can scale lower body strength right back to just using machines. So for example, the leg extension machine, the hamstring curl machine. If you have a hip thrust machine, that's amazing. Cables for abduction, adduction, calf raises. 17, don't neglect upper body strength as well. You want pressing movements, pulling movements, isolated work for your triceps, and isolated work for your shoulders. In terms of minimum effective dose for lower and upper body strength, I would go for 3 to 4 days a week. So you could either do 3 days a week, so you could do a lower body day 1, upper body day 2, and then a full body day 3. Or you could do a 4-day split where you have 2 lower body and 2 upper body strength days. Number 18, don't neglect your aerobic base. So essentially your conditioning. How do you do this when you have lower back pain? Again, we can scale this all the way back and use things that aren't going to irritate the lower back. For example, swimming is a phenomenal option because it's very, very low weight bearing and you're getting everything moving and it doesn't tend to irritate the lower back. Maybe just do 20 or 30 minutes a few times a week when you can. Point 19, which is really underrated, is making sure you're sleeping 8 to 9 hours a night. If you're not sleeping 8 to 9 hours a night, then the rest of this advice about mobility, strength, limiting beliefs is all like complete rubbish and it won't work because your body needs 8 to 9 hours of sleep a night to recover and get your lower back stronger and retrain your brain in these different positions. There's loads of research on this that sleeping like less than 7 to 8 hours a night increases your injury risk by about 50 to 60%. Number 20, reduce or quit alcohol intake. Alcohol is linked to depression, but also inflammation in that area, especially around the lower back. So if you can reduce your intake, point 21, eat 1.5 to 2 grams of protein per kilo of body weight. So if you're training hard, doing your strength work and doing your lower back rehab work, and you're quite active, you need to make sure you're repairing the muscles and getting enough protein in. I weigh about 80 kilos, so if I was going for 2 grams per kilo of body weight, that would be 160 grams of protein a day, ideally split up into 3 to 4 different meals. Point 22, try to hit 5 to 10k steps a day. Walking is amazing for mobility and de-stressing and cardio as well. Try to fit these in short, sharp bursts. That works well for most people because we're all really busy. So if you work at a desk, trying to get out at lunch or before work or after work, or if you've got 2 minutes and you're making yourself a coffee or a tea, just get up and walk for a few minutes when you can. 23, stay hydrated. So a lot of us are just drinking water throughout the day. I'd recommend also taking electrolytes first thing in the morning, or if you train frequently, like more than once a day, then potentially also during like the second or first session, depending on what sort of training you're doing. So just make sure the electrolytes you get have a good amount of sodium, potassium, and magnesium, because those are the three things you need to actually hydrate yourself properly. If you're just drinking water, essentially you're actually just dehydrating yourself more, because the water is essentially pulling all the vitamins and minerals out of your body as you're weighing them out. 24, take creatine. So creatine is one of the most researched supplements in terms of improving strength and power outputs, but also improving cognitive function. And they've just done some research recently on how important creatine is for helping people with dementia and Alzheimer's. And I think in the future they're going to do some research on rehab as well. And I bet it will come out with, showing that creatine is massively helpful for improving, help people recover from chronic injuries. Because again, as I mentioned, lower back rehab is hugely brain related. So yeah, take 3 to 5 grams of creatine a day. If you're over 85 kilos, then I'd recommend bumping it up to 10 grams a day, but nothing more than that. The last point, take vitamin D3. If you live in the Northern Hemisphere, Northwest Europe, you're likely deficient in this. And at baseline, I'd aim for around 4,000 IUs a day. And you can just buy this in tablet form. And usually like the one tablet just has that amount in it. So it's really easy to take in the morning. You can take it with your creatine and your electrolytes.